And now we're going to move on to the technique portion of this lecture. So when we do breast ultrasound, you want to use a linear high-resolution transducer with a minimum frequency of at least 12 megahertz that has an adjustable focal zone. In our practice, most commonly we use a linear transducer with an 18 megahertz minimum center frequency. You want to use a coupling agent such as gel if possible. You can get these little machines that keep your gel warm so that it's a little bit not so upsetting to the patient. You're not dumping cold gel on her, but we keep our gel in these little machines that just keeps it warm just for patient comfort. For very superficial lesions in the breast, these standoff pads are available. However, a nice blob of gel is easy to create the same effect as these standoff pads. So here I've shown you a lesion that's within the dermis. So again, here was that skin line we talked about. And within the skin, we have this very superficial lesion. So basically, these standoff pads or blobs of gels give you nice contrast for these very superficial lesions. So just a nice trick for a technique to use for very superficial lesions to see them better and better delineate their margins. Patient positioning is very important. So when we perform breast ultrasound, the goals of patient positioning are really two things. We want to minimize the breast thickness so we can see lesions well, and we want to create a reproducible image. And why we want to create a reproducible image is because very frequently I might be the doctor originally seeing the patient, doing her workup, finding the lesion and recommending it for biopsy. But it's not very common that I will also be the same doctor coming back and doing her biopsy. So just in case you're not doing everything for that patient and your colleague or your partner or another doctor may be coming in to do the biopsy, you want to make sure that they can, without a doubt, find the same lesion that you've documented and recommended for biopsy. So to do this in a woman with small breasts, it's pretty easy. It's more in the women who have larger pendulous breasts that it's really important to position them properly so that we can create a reproducible image. And what we do is, as shown in my graphic representation, we ask the woman to put her ipsilateral arm for the breast that you're scanning abducted and hand beneath the head. For a woman who has a large breast, for example, I've documented a lesion here that's in her outer breast. We always want the nipple to be pointed towards the ceiling, and that again is so that your clock face means something. You can see that if her nipple was pointed falling laterally or medially, your clock face and your distance from the nipple would be very variable. So in order, for example, in this lateral lesion in her breast, for her nipple to be pointed towards the ceiling, sometimes it's helpful to put a wedge under her that lifts the breast up and gets her nipple pointed towards the ceiling. So very important to make a reproducible image, and these techniques for positioning are very helpful.